Hi, my name is Eleni Gomez, and welcome to my last presentation, I think. Okay, for my topic, I choose the X-ray and CT. So let's begin. Okay, what is an X-ray? Okay, an X-ray is a fast, non-invasive imaging test that uses a small amount of ionizing radiation to produce images of the inside of the body. Right, but how this works? Okay, the X-ray energy beams pass through the body. Different tissues absorb the radiation differently. For example, the dense material like bone absorb most of the radiation and appears white on the images. On the image, like we can see in this example in the screen, that is the bone of a leg. And now, the less dense material like soft tissue and air allows more radiation to pass through and appears gray or black, like we can see in the muscle of this leg. Okay, but how we can use that? Uh, we can use that, for example, identifying bone fractures, diagnosing some lungs conditions like pneumonia, and detecting foreign objects. This is highly used in the emergency rooms. Okay, now let's go with the CT scan. Okay, the CT scan, also called computer tomography, it is okay. A CT scan, also sometimes called a CAT scan, is a more detailed imaging technique that combines a series of X-ray views taken from many different angles to produce cross-sectional images or slices of the body. Okay, but how this work? Okay, a rotating X-ray tube and the tether array circle the patients, taking hundreds of measurements and computer then process test measurements to create detailed three-dimensional images of organs, soft tissues, bone, and blood vessels. How we can use that? The primary uses are for diagnosis cancer, assessing internal injuries after trauma, identifying the causes of pain, and imaging the brain, chest, or abdomen with great clarity and a simple X-ray. So this is more detailed. But note that we mentioned that there is a difference. What is the difference between these two? Because it almost do the same if we think, but they not. For example, the key difference between those two is the detail and dimensions. For example, an standard X-ray provides a two flat-net view of the body, while a CT scan provides highly detailed 3D cross-sectional views, making it much better for examining soft tissues and complex structures. So, this is more detailed and it's more helpful for specific things. But the X-ray is used in general things like fractures and whatever they need to see. Okay, now I'm going to be reading the exercises of this chapter. I'm going to be reading from my book because it's more easy, but you can see what I'm going to be reading the whole time in the screen. Okay, let's start with the 37.1. Choose the correct word or phrase to complete each sentence. Look at A and B opposites to help you. Number one, in radiography, barium is used as a contrast medium. Two, tissue which absorbs radiation and appears white on an X-ray is radiopaque. Three, an enema is a liquid introduced into the bowel by way of the anus. Well, 4. X-rays used to measure the progress of a disease are called serial. 5. If a patient moves during an X-ray, the image may be blurred. 6. It's easier to see abnormalities when the lungs are inflated. Okay, let's go with the second one. This is 37.2. And it says, complete the words. It begins with radio. Look at A and B opposite to help you. Number one, using radiation to diagnose and treat diseases is radiology. Two, using radiation to make images is a radiography. Three, using radiation to provide treatment is a radiotherapy. Four, if something is not penetrable by radiation, it is radiopaque. Five, if something is penetrable by radiation, it is radiolucent. And six, a technician who administers X-ray is a radiographer. Fine. Let's go with the 37.3. And it says, complete the radiographer's instructions. Look at B opposite to help you. Okay, so we're gonna start. Please stand facing this board. Put your hands on the back of your head and your elbows forward. I help you. I help you push your elbows out. Keep still. In a moment, I'll ask you to take a deep breath in and hold it. Fine. Hold it. Breathe in, hold it. That is fine. You can breathe out. Thank you. I need you to shed the film. Now I'm going to take a side view. Can you stand sideways with your right side close to the machine and your arms raised? That is all for this. We're gonna repeat in the last one. That is 37.4. And it says, complete the table with words from B and C opposite. We got the verb on the left, the noun on the middle, and the adjective on the right side. And it says, abnormality is abnormal. Breathe is breathe. Drain is drainage. Intervene is intervention and interventional. And therapy is therapeutic. So, over to you. Explain to the patient what an X-ray is and what a CT scanner does. So, that was all for this chapter. I want to say thank you for your attention. And that's all. Have a great day. See you later. Bye.